Okay, it's important to talk about typical changes seen in response to a carnivore diet with regard to blood lipids, okay? So first of all, we need to realize that there is pretty significant variability day to day in what your blood lipids show. So if you were to get your blood drawn on Tuesday, it could be very different on Thursday. So that's the first fact that we need to be aware of. The typical response to a carnivorous diet are a number of favorable things, such as an elevation in the so-called good cholesterol, HDL, and a lowering of the overall triglyceride amount. There's a ratio between triglycerides to HDL that is considered favorable if it's less than 2 in many cases. We also see a decrease in something called remnant cholesterol, which is a value that's determined by taking your total cholesterol and subtracting both your LDL cholesterol and your HDL cholesterol. Those numbers typically indicate that they go lower, and that indicates less risk. There's a lipoprotein A fragment that also tends to be lower. Again, this also indicates decreased cardiovascular risk. The only thing that may go up, and it doesn't always happen, but total cholesterol and LDL will also rise in some cases. That may or may not be negative depending on what's going on with the other particles in the blood. We also need to look at the type of low-density lipoprotein particle. If they are large, they are considered less atherogenic than the smaller dense particles. And so you can get advanced lipoprotein testing to determine that. The final thing has to do with looking at underlying inflammation and hyperinsulinemia as those impact the blood lipids.